My name is Ryan Fleming, and I'm a physician assistant with LMH Health, Ortho Kansas. My practice is operating the Express Clinic, and so it's geared towards general orthopedics, which means I'll evaluate any type of orthopedic or musculoskeletal injury. Upper, lower extremities, every joint you can think about, even a lot of soft tissue trauma that we evaluate in orthopedics. But yeah, in the Express Clinic, describing my practice, it's primarily evaluating acute injuries, so things where there's either been a trauma within the last 14 days or the symptoms have developed or heightened or increased within the last 14 days. My practice, we obtain a lot of imaging studies, a lot of x-rays. In orthopedics, you need to see what you're evaluating, and so a lot of x-ray imaging is ordered. Here we have the capabilities for laboratory analysis, so we can get lab draws if needed. We have a really amazing physical therapy, occupational therapy department. We utilize them a lot in our practice. And then the team of the specialty surgeons, the non-operative physicians, and the APPs, they're kind of all involved in this particular practice. My personal philosophy of care is primarily about patient-centered, patient-focused. When a patient is presenting with an issue, no one knows the symptoms better, what they're experiencing, than the patient themselves. So I think it's really important to have that engagement, develop that relationship and trust, ask the right questions, listen. It's not always about just me talking and telling them what I think is going on or what I recommend. That listening component is really huge in attaining a proper history and figuring out what's going on. Another component of I guess my philosophy is just doing absolutely everything within my personal and professional capabilities to help the patient. Giving it my all and doing everything possible to make sure they feel that and they recognize that, and they hopefully at the end of the day can appreciate that and get a good outcome. I enjoy most the relationship that I can develop with patients and their families, and the opportunity that they provide me to help them recover, help them return to their normal function. I think that's, it takes a lot to earn somebody's trust and respect. And I feel as a PA, that's something you're able to do on a day-to-day basis with every patient that you see. I think one reason patients should come to LMH for their orthopedic care is because it's local, it's convenient, and it's extremely high quality. I've worked in several different components of medicine, and I can honestly say I've never worked with a better team of surgeons and physicians and physician assistants, nurse practitioners that I do here. This is where I would come for my own medical care, orthopedic care. I recommend it to my family, my friends, and so I just think it's that high quality, it's the thoroughness, it's all the capabilities that we have with all of the different subspecialties. I think it's a one-stop shop for everything you need in regards to medical care.